We are live streaming the event on YouTube channel, Hawaii Pacific Health right now. And once the live stream is finished, you'll be able to watch the video on playback. I would now like to introduce Jen Shahanovich, President and CEO of Wilcox Medical Center and Kauai Medical Clinic.
Well, good afternoon, good evening, good to see everyone. So I was very fortunate that I got to greet you on your first day, and now I get to say thank you on your last day. So we have 20 students, and we have enjoyed every minute, but this is very selfish of us, because we want to introduce you to our health system. We want you to see different career paths, see what we do, how we take care of our community, how we love what we do. We want you to go get your degrees, and we want you to come back, and there'll be a job waiting for you guys. You got to see a lot, you got to do a lot, and I met with you halfway to make sure you were seeing. You got to see C-sections, you got to see total hips, total knees. You got to participate in what we RIMPAC, which is a big deal, 20 countries coming together. So thank you for everything you did. We enjoyed having you. Your projects are great. The work you do is fantastic. I wish you the best in your career, and I look forward to your applications to work with us. So take care and enjoy the night, and we love celebrating with you. Thank you.
To hear from our interns firsthand and their experiences, we'd now like to invite up to the stage Wendell Mark Soriano. He was in the emergency department. Wendell, you come on up. A little bit about Wendell, Kauai High School graduate at the University of Colorado at Denver right now. Favorite food from our famous cafeteria is the pork adobo. Hashtag to describe his internship is Oceanholic. He might have to get into that a little bit more. But best scrubs, he said he would design, would be my scrubs would as blue and with wave patterns. So welcome on.
Hi everyone, my name is Wendell Mark Soriano, and during this summer internship, I was lucky enough to call the emergency and ICU my home department. In my department, I had tasks such as bringing patients to their rooms and providing them with a gown and blanket, sanitizing rooms, wheelchairs, and equipment for the next person to use, among many more. This internship was a great learning opportunity that allowed me to speak with and shadow many health professionals and also gain insight of working in a healthcare facility and the different departments within it. One wow moment I experienced was a cold blue that occurred in the ICU. I consider this a wow moment because there were a handful of people all just trying to work together to resuscitate the patient. It was saddening to see the patient in the situation, however great to watch different workers from different departments all just trying to do their best to resuscitate the patient. If I was taught anything during this internship, it would be to be patient with nurses and doctors and to be more thankful for them. Be patient and more thankful because working in healthcare is a stressful job, and with the shortage of staff, their jobs become 10 times more difficult. Another important lesson I was taught is that no one has a more important job than another in healthcare. Each department has a critical role that contributes to keeping the hospital running, and if any department were to be gone, the hospital wouldn't be able to run. This first-hand experience will definitely help with my career path because I now have an idea of what it's like to work in a hospital setting. This internship also allowed me to receive advice and a sense of direction from real-life doctors and nurses about all things healthcare. I want to become an emergency room nurse practitioner, and with this experience, I have a taste of the ER. I am confident that I will stick to pursuing a career in healthcare because of this opportunity. And to end it, I would like to say thank you to everyone that had a hand in allowing us to have the best experience as possible. Thank you.
For another intern reflection, we'd like to have Graylin Kaiban come on up. Kauai Medical Clinic Operations was her home. And a little bit about her, what high school was Waimea High School. She's at Colorado College right now. Favorite food from our cafeteria, cinnamon rolls. And hashtag to describe her internship is one for the books. One for the books. Best scrubs, Eeyore from Winnie the Pooh. I agree with that.
Aloha everyone, I'm Braylon. First things first, I would like to say thank you for all the HPH employees for making this internship happen and making it so memorable and special. Over the past 6 weeks of being a student intern at Wilcox, I grew as an individual, student, and a community friend. But one of the main lessons I learned from my internship experience is flexibility, humility, and gratitude. This internship threw me curveballs and surprises. I encountered challenges I hadn't foreseen before and experiences that marked me in 1,000 small ways. Before I started this internship, it did not hit me, a 19-year-old, that I was working in a real-world setting, like this is a real deal. It isn't always rainbows and sunshine. For example, I did not expect to experience the hardest part of being in the medical field, losing a patient. But it was a heartwarming experience to see how the Wilcox employees developed a relationship with the patient's family who was getting through the loss of their loved one. But seeing how all the Wilcox employees supported each other and the family of the patient during this hard time made me realize that the worst part of medicine is also its very best. The compassionate and caring employees at Wilcox taught me to always acknowledge that there are many people across many other professions at Wilcox, such as nurses, food service workers, and ward clerks, who are a wealth of information and intuition. I quickly learned how losing a patient is not a final defining moment for the individual or the relationship that occurred around it. It was at that moment I realized that I wanted to be a family medicine physician and do everything in my capability to make sure that patients and their loved ones are not alone when walking the mountain of life. Because if I was in their position, I would never want to be alone too. Lastly, I've been blown away more than times that I can say during my experience by the incredible privileges of this internship. It is about the capacity to make a difference in 100 small ways every day, and keeping sight of that is everything. This level of maturity that I have now about the medical field and life, of seeing the patient and not the illness, is what will push me to become the physician I want to be one day, who serves the community I hold dear in my heart. Thank you.
In addition to the various workshops planned throughout the 6 weeks that the interns were also asked to complete internship insights. They were asked 2 questions every week to help reflect on their experiences. We'd now like to present an award recognizing one of the interns with their most valuable insights. To present this award, may we have Shelley Ihori, Associate Director of Workforce Development, come on stage. And then it's Jackson Cable Treadwell. So while Jackson receives his gift, I'm going to read what he said. I've realized new possible career paths that don't include a physician-type route because I've been exposed to so many different types of people with various degrees, licenses, and specialties that are all so important in healthcare. This internship has definitely given me something to think about in the future, but now I know I want to enter the medical field. We'd now like to present the certificates to our interns, and I'd like to have Jen Johanovich, President and CEO of Wilcox Medical Center and CEO of Kauai Medical Clinic, up to help us with that. And Shelley, we'd also like to have you up. Thank you. And I'll be announcing the names in alphabetical order. First up, we have Taylor Bradley, Security. Next up is Serena Bryan, Patient Services Administration. Jackson Cable Treadwell, Trauma Center. Braylon Kayuban, Kauai Medical Clinic and Operations. Audrey Dudley, Food and Nutrition. Annika Evanov, my department, Philanthropy. Deshani Esri, Pharmacy. Kaden Kobayashi, Cardiac Services. Wailana Marvin, Perioperative Services. Ashley Nagahiro, Sterile Services. Sammy Ofisha, Kauai Medical Clinic Operations. Lilia Olsick, Patient Services Administration. Caitlin Palacio, Imaging. Kiana Pia Salvador, Physical Therapy. Sawyer Rogoff, Patient Safety and Quality. We have Wendell Mark Soriano, Emergency Room. Alexis Mele Tito, Patient Services Admin. Alexis Mele Tito. Janelle Tangelin, Nursing Education. Tony Jordan Omala, Marketing. I believe Sean's here, but Sean Pakuanawan, let's give him a hand too. We'd now like to reflect back on the experiences with a slideshow, so please cast your eyes in that direction. in closing, we just want to thank our interns again. We want to thank our families for coming out in support of our interns, and all of our staff for being here tonight and hosting our interns. And that concludes the evening, but please, there's extra food, and please mingle and spend time with each other. Thank you again.